So I like to think of epidemiology as um, kind of a doctor of the entire population. So if you go to your primary care provider, let's say you've had this person, you've been going to this person for a number of years. They know your family history. They'll know any chronic conditions you have, any injuries you've had in the past, any surgeries. They'll know your whole health history. And so when you go for your checkups, or if you happen to have a health issue pop up, then they can look back into your file and kind of better understand your current situation by looking at what has happened to you in the past. That's essentially what epidemiologists do for the entire population. So they're in charge of tracking all data on chronic and communicable disease. They seek to discover the cause of diseases. So a good example that we see regularly are foodborne illness outbreaks. So if you're in an area where there has been a number of calls calling into either your local or your state health department complaining of food poisoning, as we kind of call it in general terms, foodborne illness, at some level, typically the state level, you're going to have more epidemiologists working at the state level than the local level. But they're going to seek to discover the cause, not only the restaurant, but the specific food and then the specific bacterium or virus that is causing, or parasite, whatever that agent is that's causing that issue. They also look at patterns and trends. So, going back to the PowerPoint on the leading causes of death, I talked about how the current 5 leading causes of death have really been flip-flopping over the past 10 years. And right now we've actually seen unintentional injuries bump up to number 3 of the top 5 leading causes, where it used to be 10 years ago, number 5. Well, epidemiologists are responsible for tracking that data and putting that, into, those rank orders. They also recommend a means of prevention and elimination. Once we know the cause and establish patterns, then the next step is looking at how we can eliminate and prevent future outbreaks. If we're looking at foodborne illness, obviously it might be shutting down the restaurant for a number of days, obviously getting rid of whatever the contaminated food or foods are, and then maybe looking at some sort of inspection schedule or additional training for their staff, something like that. And they're really working on all levels. So they deal with diseases worldwide that are either endemic, epidemic, or pandemic, and those are actually, I think they're defined on this next slide. Yes. So, one of the things that again, going back to this idea of epidemiologists are doctors of the public, it reminds me of a quote that one of the former directors of the CDC said, that was, he loved being a clinician. He was a clinician originally, probably a physician of some sort, but moving to public health has been so much more rewarding, because at the public health level, which you are all studying to be public health professionals, the entire, population is your patient. And so this ability to make macro level changes to the population instead of just an individual person one-on-one as physicians do can be really rewarding. So this might be a field that some of you are really interested in. We have students go on after graduating with this degree in community health to go on to get an MPH in epidemiology. So you'll have a wealth of possible resources during this program to prepare you for that, if that's something you're interested in. Epidemiologists make a pretty good living, in comparison to other professionals in the field of public health. So if you like studying disease patterns, you like data collection, you like statistics, this could be a really rewarding career for you.